Again, my name is Leilani Maxera, and today I'm going to be talking about what is a death doula accessing community death care. Um, and just a little bit about me. Those are my cats. I always prefer to put a picture of my cats other than myself up when I do my about me. I was born and raised on the continent. I'm from the Bay Area. I'm from California. I'm Kanaka, though. I came home to Hawaii when I was 33 years old. And I left my paid work in harm reduction a little over three and a half years ago to pursue care work full time. So I have a master's in public health and I'm a licensed clinical social worker. And I started my own private practice. Kaipo Loku. I do therapy, death work, and consulting. And I've been on my death work journey for about 18 years now, and I'll talk a little bit later about that. I find when I talk about that at the beginning, it gets a little emotional for some people, so I'm saving that for a little later down the presentation. And I'm a death doula. I prefer calling myself a death and grief worker, but we'll get into that in the next slide, like what that means. So if you haven't heard the term death doula, basically a very minimalist explanation is that it's a person who provides support for individuals facing serious and or terminal illnesses and the humans and community that surrounds them. So you've probably heard of a birth doula, right? So it's kind of a similar thing, but more towards the end of life. And people don't have to just be seriously or terminally ill to access doulas, because in times of wellness, we can be utilized for other things too, like doing pre-planning, talking to people about their fear of death, helping folks through that. And after death, a lot of death doulas do ceremony, grief work. And you might have also heard other terms because death doulas call themselves many things. You might have heard end of life doula, death midwife, soul midwife, death worker, full spectrum doula. And often you hear the term full spectrum doula if someone who does work with people birth through death. So I know a few people who are birth workers who also do death work, which comes up a lot, unfortunately, when you do birth work, is something we don't talk about a lot, right? A lot of babies do die. And so death companion and other terms, I've heard lots of other ones. For myself, I prefer calling myself a death and grief worker because I feel like death doula often has the connotation of people that does bedside work. I think that's the stereotype that people sometimes get when they hear that. Whereas we can do a lot of different things. And death doulas are a part of community death care. And so we think of community death care, there's just so many different types of care work that have to happen when people die. And so the next slide, I'm just going to go over different things, because some of this care work, it might resonate with you as like, oh, that's something I definitely have done myself. Is that death work? Is that a part of death work? And the reality is a lot of us have done death work and not even realized it, like what would be considered death work. And some of it, might sound unfamiliar and overwhelming, and we'll have time to talk about it. So when we think of weaving care work into community, there's just so many different aspects of death work that need to happen when someone is seriously ill and or dying. So we think of the healthcare aspects, right? Is somebody enrolled in palliative care? Are they enrolled in hospice? Do they need, advanced healthcare planning? What does that look like? Do they need help getting to appointments? Do they need help talking to providers? Body care, sometimes, pre-death, people need physical body care if they can't take care of themselves. And that body care also can happen after death, like washing a body, preparing a body for ritual, or home funeral, or to be taken somewhere else to lie in vigil. The everyday work that sometimes people think, oh, is that community death care work? And you might have done more of this, of like, is somebody sick? Is somebody having a hard time? Did you give their kids a ride to school for them? Did you bring them food? Did you check on them when they, on your neighbor when they weren't doing well? All of this is community work that you may just do on your own and not even think about it as such, right? The financial aspects of, like wills and trusts, etc. Um, Disposition, which includes, that can include burial, cremation. We have aquamation now here in Hawaii. Um, green burial, what does that person want? How do you plan ahead? Grief work can happen, of course, before and after death. Sometimes there's a lot of anticipatory grief. There's a lot of grief work done with families and loved ones that are having a hard time coping with the fact that their person is dying. Ritual, some death workers are more involved with ritual than others in terms of like, what would you like pre and post death to happen around that? Could be very different for everyone depending on their culture and religion. And then also legacy work is something that death workers often do, that that maybe people do with their family, but maybe they want someone outside the family to help with that. That can include anything from something really simplistic like, I bake a lot and I have all these great recipes and they're all over the place and I need somebody to put them together in one place for my family so I can pass them on, or videotape me making these recipes so that there's some legacy there that people can keep with them. Storytelling, keeping people's stories alive to pass on, sorting through photographs, like all of that's different legacy work too, that sometimes people choose to do with their family, but sometimes they need outside help with. And so the question when you call on a death doula is very different for everyone, right? Because some of the stuff I just talked about is very, you might have heard that, just be like, yeah, I've done that for so many people in my life. In my family, people have done that type of stuff for me when someone I love has been sick or died. But it's really, it can be really nuanced, because the reality is, I think especially here in Hawaii, something that's been different for me living here than California is often when I give these talks, people are like, why would I have anyone come in and do that? And I think that's because here locally, it's more common that people have their family unit intact and perhaps even in the same house, on the same island, and people lean a lot on family, loved ones, neighbors, whereas that's not always the case for some people. Some people have no one, right? So that's why it looks really different when you would call on a death doula, because some people, you might hear this and be like, oh, I don't need help with any of that. I got all that covered with the community that I have, with the church that I go to, with the strong ties I have, to all my friends I grew up with, et cetera, right? But for some people, they might have to call on help pretty immediately with this stuff. They might not have people to help with any of it. So I think it's really individual what that's going to look like. And that's why it's so individual what different death workers and death doulas do. And so just to give a little bit of an example of how different this can be, I'm going to talk a little bit about some of the work I do. And I'm going to give some examples of a few other death workers here and how different that can be as well, towards the end. So some of the community death care work I do, as I mentioned, I'm a therapist in private practice, so I'm pretty busy. I actually have a full practice with a long wait list, so I don't get to do as much community care work as I'd like, to be honest. But the example of how different it can look is, for me right now, one of my biggest focuses is medical aid in dying. Here in Hawaii, we are the only state that currently has a law that you need a mental health evaluation as a component to part of doing your request for medical aid in dying. Other states, this step doesn't exist. But here, a licensed therapist has to sign off and meet with the patient whose request is made. They've had to have put their first request in and say, meet and talk story with them and sign off saying this person understands what they're asking for. We're the only state that requires it. And I think also it at some point, hopefully they will change the law, because it's actually kind of repetitive in that the first doctor who said yes to the request already decided the person had competency. They already decided, right? So it's a little bit of an extra step that can be kind of a burden on people. And so one of the reasons I volunteer doing these requests is because it's actually very hard to find a therapist that will do it if you're outside of like a healthcare system. So Kaiser has, palliative care and hospice folks in-house, Hawaii Pacific Health, but like let's say you have HMSA and you're going here for palliative care and you're going here for this, like they don't just have someone to call. So I volunteer doing these evaluations, and I've done I think over 60 in the last couple of years, for free, totally pro bono. And I consider that a huge part of my death work is that it's a barrier to care. It's a barrier for people accessing getting medical aid and dying here. And I also co-facilitate 2 virtual medical aid and dying grief support groups for folks who, not for folks who are choosing MAID, but loved ones and other humans in their life, because for some folks, they've had feedback that they've gone to other support groups and they felt like maybe scared to talk openly about the fact that their loved one chose MAID because there's still a lot of stereotypes about it. Or they are, worried that other people, they're worried what other people might think, or they've talked about and be like, well, that's really different. Your loved one chose when they went. That's not the same as my experience. So I do 2 support groups, both also pro bono, one here focused for folks in Hawaii and one for folks anywhere to join, right? So for me, medical aid and dying is a big focus of the work that I do. I'm also on the board of a Sacred Passing, which is an org that's actually based in Washington. And we were gifted a house, which was a very beautiful gift from a woman who sought death care through the org. And she said, she was an older lesbian. She's like, I don't have kids. All my family has their own houses. She gifted us her house. And so what that looks like is now we have a home where people who choose medical aid and dying and or voluntary stopping eating and drinking can go to die. If they had nowhere else to go, let's say they were houseless or lived in a transitional place where they had nowhere to go to die, or they don't want to die at home because of the family situation, or where they live, it's inaccessible, they can come to the house to die for free. Of course, donations accepted, but it's no one's turned away for lack of funds. Anybody can go there to die. So that's one of their biggest focuses, keeping this house running. We actually have a VSED patient there right now, who has started their process of voluntary stopping eating and drinking. And we have a whole slate of volunteers that come in and they take turns doing bedside, sitting with the person and making sure their needs are being met and talking with the loved ones and family who come to visit. So a Sacred Passing does other things too, but that's one of our main focuses right now is that. And I co-facilitate a community death care course online that we offer, that anyone can take. And it's virtual, so people anywhere can just log on and learn how to do community death care work. I facilitate a free monthly webinar series and virtual community care book club. We choose books that get people talking about care work and how we're taking care of each other in community. And the first and third Wednesdays, I volunteer doing a grief and care under capitalism support group, which is a grief group for anybody feeling like they're having a hard time, because grief doesn't just come from death, right? I also do several other grief counseling, and I do several other support groups. I offer individual grief counseling, and my specialty is advanced care planning, which I've been doing for over 15 years, is having talks with people about advanced directives.
Quick question for you, and you may address this later. If so, just is there a list of providers who do MAID consultations and mental health assessments that is available for us to connect our patients with?
No, but you can contact Compassion and Choices. They will connect. They usually will connect you with people. So just over time, different providers have figured out that I do this and contact me over and over again. And then sometimes they're like, I can't find someone. They contact Compassionate Choices and they're like, oh, we know people. Because I'm not the only person that does them, but I've been doing them for a while now.
So
Um,
compassionatechoices.org, maybe?
compassion and
And
compassionate
mm,
choices. I don't know if I'm saying it right. I'll have to put it in the chat.
okay,
So,
cool.
but yeah. And so, just to share, as I said earlier, I kind of saved this more towards the end because I don't want to get choked up or, focus on the emotional part of this. But the reason I came to death work is that a little over 18 years ago, it'll be 19 years in May, um, my grandmother was very sick and for a long time before that, and she died. And she had dementia, and she ended up, we didn't know what was going on, but we got the biopsy results back after she died, and she had pancreatic cancer. And the experience that I had really kind of mimics what I was speaking of earlier when there's families that have big support groups, are in community, have a church group, have other people that they are just in community with. That wasn't the case for my family. A very small family, no religious affiliation in terms of places we went. My grandmother was not a very social person. It was just me, my aunt, and my mom, pretty much. And so the taking care of her when she had dementia really took its toll. I was having my own health problems as well, so I worked full time because it was before the Affordable Care Act. This was a while ago. I needed health care. So I worked full time and took care of my grandmother on the weekends and then went back to work, right, for a couple of years. And to be honest, after she died, I had a nervous breakdown. It was the worst experience of my life because I knew that there was just so much I didn't know. What could we have done better? What could we have done differently? And if any of you have had the experience of being a caregiver, that's all you're focused on, right? So it's really hard unless you have outside people giving resources, telling you, what to do, where to go. It's really hard to, and when I'm talking that long ago, this might be hard for some people younger than me on here to understand. We didn't have the internet at our house. We didn't own a computer. It was a couple more years before I owned a computer and had the internet after that, right? So it's not like I could just Google like caregiver resources or end of life care for my grandmother. And so they were pretty in denial too when she was sick, in that she was never offered hospice. She was never offered palliative care. They never asked us if she had an advanced healthcare directive, right? And so you don't know what you don't know, right? So had this horrible experience, miserably depressed after she died. And then I just started, and I was obsessed with what could I have done better? What could have been done differently for her? And then I learned about hospice, and I learned about palliative care, and I learned about advanced directives. And honestly, I was mad. I was really mad that none of these things were brought up. We just took her, she ended up going to the emergency room over and over again. And they'd send her home. We'd take her back to the emergency room, and they'd send her home. Right. And this went on for a couple of years. So, and she ended up dying at home. And so I share that with you because my journey into doing death work came from a place of anger, which is not the same for everyone, right? We all come to this. Some people, it's a very spiritual calling. Some people, it just feels like it makes sense to them. And my death work journey truly came from, I don't want anyone to ever go through this again. And so that's where it got started, right? So I talked about what I currently do, but it's looked very differently over the years. Some of you are familiar with the PULSE form, Provider's Order for Life-Sustaining Treatment. I use it, in a former life, I ran that program for the state of California. I've done, I've been a hospice volunteer. Like I used to, teach other providers how to advance healthcare directive conversations back in California. So it's looked really different over the years, but this is where I've landed in terms of how can I make community death care more accessible to people. And so I want to be really clear that there's no certification for being a death doula. This is one of the biggest questions that I get asked. And because there's a difference between certification and education, right? So I mentioned earlier, I teach a community death care course. People take that course, they're going to learn how to be in community with people. And a lot of it is truly just like communication, um, kindness, how to listen. That's a huge part of it, right? But there are a lot of organizations out there that offer courses, and they'll say like, oh, become a certified death doula, or, this is get your certification. And to be honest, it's really, really angering to me because that's not real. There's no certification for it. And I think that it's a marketing choice because it sounds more official. So there's these orgs like, well, we want your money. And so if we just say we're teaching an education course, that doesn't sound as like fancy as like this is a certification course. So if they're charging more, it's certainly a marketing choice to use that language. Um, and there are some death doulas who want to create a certifying body for doing death work, and I'm very against it. And, one of the reasons being a lot of this, it wasn't the case for me. Like I mentioned, I'm Kanaka, but I grew up on the continent and I didn't grow up with my Hawaiian family. But for some people, culturally, this was a role that they had. This is something this was knowledge that was passed down. And in many cultures and many religions and everywhere all over the world, death care is a very natural part of family life and community life. And it's just information and skills that are shared. And so creating a certifying body, the argument that people have for it is that they can charge insurance. If they're working with families. And the reality is, many of you are acupuncturists or people who do massage or whatever. How much do you get reimbursed for insurance? $20? Most people don't even take it, right? Because it reimburses so badly for non-medical services. But also, a great example of why this can go so wrong is you could see the fight now. And I can't remember the name of the bill that's up, what happened here locally with cultural birth workers in Hawaii, and how people have been, same thing, people have passed on this knowledge generation generation. It's a natural part of our culture, and now they're like trying to regulate it to hell so that it's illegal for people to do what they've been doing for centuries, right? So, there's all different ways to do death work, but certification is not really the direction to go, even though there's people that push for it, and also people that lie that say they certify people.
Well, I have to agree with you there because physicians are looking at getting out of the insurance market because it's so much darn work
Yeah.
for the little bit you get. But we did have a quick question and we did have
Yeah.
condolences for you.
Oh,
Um,
thank you.
how do I register for your course?
Oh, I can put that in the chat once I close the
Perfect.
slides. It's hard for me
Okay.
to type when I
Hmm.
put the slides up, but
Yeah,
after I close these and we have questions, I could throw that in there real
perfect.
quick.
Okay, thanks.
Thank you. And the condolences, I guess I'll see when I also uh, put the slides down. But thank you so much. So yeah, so in terms of that, so what I always say is like, there's plenty of places that teach death doula courses. I'm one of those people that's like, yes, I teach a community death care course. It's sliding scale. Everything I do is sliding scale or free. Like even the therapy that I do, because I truly believe like people pay what they can. And but there's tons of other community death care courses out there, like maybe online doesn't feel accessible to you, so there's some in person all over, but I think it's really important to just look at the language that people use. If they're saying they're certifying you as a death doula, that's a red flag. But besides that, there's plenty of good courses out there. And then just for more discussion on this, recently I mentioned a presentation for Kokuamau about this topic. And they, it was myself and a couple other death workers, so we kind of got a little bit more, debatey about the topic. If you want to watch that, and the videos up on their website, there's a link in the slides. And then a sacred passing, the org I mentioned that I work with, God, was it July or June of last year? We actually did a webinar just on the topic of certification, to get people talking about it. And it got heated, but it's on there on the internet for everybody, right? So, and then just to share a couple other people's names to bring them into the room. There, and to highlight the differences in care. Joy Rodriguez is somebody I work really closely with, who's a death doula here in Honolulu as well. And her specialty is being a bedside companion for people going through medical aid and dying. She has tons of experience with all the steps of it and mixing the medication. It's not just that she only works with those folks, but that's her specialty, right? So that, and unlike me, she does a lot of bedside companion work. And like for me, being a therapist full time, it's really hard to be a bedside companion because a lot of times you have to have like a schedule that's more flexible, right? But that's something that she focuses on. She's fantastic. Laura Miner, who lives on Maui, she came to death work also as a caregiver, but she has more of a focus on she teaches workshops and courses. I talked a little bit earlier about some people are afraid of death or or it's hard for them to face death. She does a lot of education and like experiential and individual work with people. And then Ashley Wolf is someone who's also on Oahu and came to being a death worker from being a child life specialist. And so, unlike me, works with kids. Like I have very little experience with kids. And so it's nice to know that there's somebody who's like that's their specialty is doing work, especially grief work with families and especially young children. Right. So and there's other death workers here, but I'm just highlighting these three that I know personally. That folk to, and also just to highlight the very different things that people focus on in doing community death care. So that is the end of my presentation, and I will put the slides down so that you can see the chat better, but please feel free to reach out and I'm happy to answer questions. And I'll put the Sacred Passings website in the chat.
Thanks. And let me know if you think that's the right website that I put up for the it had a Hawaii link, and so I put it in the share in the chat.
I think it is. Let me check it. So there's Sacred Passing and then Compassionate Choices.
And we'll share this.
Yes.
Okay.
That is the correct link. Good for you. You found it before me. Okay.
Well, you were busy.
So, but yeah, I'm happy to answer any questions. So.
Well, this is super. And so the Sacred Passing is your site for your training.
I could put my personal website in there too. But the training is through a Sacred Passing. Yeah, and we offer a night cohort and a morning cohort. I teach the morning one, which in Hawaii it's going to be 6 a.m. So I don't know if that's if that's appealing.
And I think we have some folks from the Pacific, so for them, it would be the night one. Okay, perfect. Well, this is great. It's a no-brainer, really, that we should have doulas for this. And when I heard of it, I was like, oh, of course, that's brilliant. But I hadn't even known you existed. So I really appreciate this talk because it's so important. Okay, we have a couple questions there. Do you know if any states recognize death doulas as a paid provider?
Well, I mean, yes, people get paid for it. I don't know if you mean insurance, and that would be a no. But yeah, a lot of people actually there's a lot of people that get paid a lot for being a death doula. I choose to offer most of my death work for free. That's a choice I make, in my what can I offer community. But yes, a lot of people that is what they do for work. It is their paid job. Yeah. And then would you please share some professional lessons? Oh, I don't know where to start on that one. It's been a lot. I mean, honestly, death work, while difficult, it's been the most rewarding thing, for me that I do. I love being a therapist. I love all my patients. But also death work, is what I choose to do unpaid outside of that. So of course it hits a little different. And also just to say, I mentioned, I left my full-time job in harm reduction to pursue being a therapist and doing care work full-time. I also have worked in volunteered in harm reduction for 17 years. So I vacillate between like I've been, paid outreach worker. I used to manage the statewide syringe exchange and overdose prevention programs for Hawaii. That's the last job I left to start my own business. And it really goes together in a lot of ways. For one, in harm reduction, there's a lot of grief. We lose a lot of people to overdose and other types of death, unfortunately. And there's a lot of grief there. So I felt like it naturally went together, but also, with harm reduction and death work being my two main loves, a thing they also have in common is one of the hardest things in both circumstances with drugs and with death is lack of autonomy, lack of choice, people feeling discriminated against. How do we make these better? How can we make these things better for people? So. And then looking on the site shared. Oh, I don't know what on the website. I don't know that it shares the list on the website, but I think you can contact them if it doesn't. I'm not involved with that organization, but I do know that they kind of collect people's names when they know that they do it. So they try to hook people up. So, and if you're interested in volunteering doing it, of course, we definitely need more folks for sure. So, and then in terms of explain again the law only here in Hawaii. Okay, so for medical aid in dying, there's several steps to it. You have to make your first request. It has to be documented. There's a time period to make your second request. But here, we're the only state that in between your first request for the medication and the waiting period and your second request, you have to have an evaluation by a therapist, basically saying that this person understands what they're asking for. And so it can be more involved. So it's not like a capacity evaluation in that what you often think of like, oh, draw a clock. Can you tell me what time it is? It's not like that type of capacity evaluation that you would give like somebody that you're wondering if they have like dementia or something. It's more like making sure the person understands how MAID works, understands what they're asking for, understands that when they take it, once they ingest, like the medication is very strong, right? So you can't spit it out. So once you ingest, understanding that once you make that choice, you will die. And that up until you ingest, you could be holding it in your hand. You could have everybody surrounding you, ready to go. You got the prescription, signed off, and look at it and be like, I'm changing my mind. So it's like kind of my job in the eval to make sure people understand they have the choice, so that if they have in their hand, they can still make that choice to not do it if they don't want to, and knowing what their other options are, etc. They can always change their mind until ingestion. Whereas once it enters your body, there's no turning back because the medication is that strong, you will die. So that's kind of the part of the eval, is making sure people understand what's going on, understand all that before I can sign off and be like, yes, they understand what they're asking for. If that makes sense.
Yeah, and I'm looking at that website, and it looks like for Hawaii, it's just resources for patients and resources for providers. And it looks like nurse practitioners, physicians, and counseling psychologists, I guess. Well, they can't make prescriptions though, so I'm not sure. But
yeah, psychologists can sign off on the evals.
Oh,
yeah.
okay.
So LCSWs and psychologists can, and I think they just passed the law that last year that LMFTs can sign off. And it says, do all states allow this? It's called MAID. Yeah, medical aid in dying. No, there's only about 14 states, I think, that allow medical aid in dying. Canada does, many other countries do, but not every state here does. Hawaii only passed the law right before COVID. So 2019, the law passed. And then unfortunately, I think they had a lot of education to roll out to like let people know the law passed, and then COVID happened. And so I still meet people, even though the law passed in 2019 here, I do meet people now that didn't know it was legal. And I think that the timing of it kind of messed up like getting the word out.
And there are still attorney generals who say they will prosecute people who do it. So, that was on a national level, but I don't, right now, that's not a big governmental concern.
Yeah.
Um,
Yeah.
but yeah. Renata says, what types of death I mean, I just remember that from when we passed it here. Our attorney general at the time said, "Oh no, I'm gonna, you know, prosecute everybody," which was just horrible when it was the law. But anyway,
Yeah. Well, yeah, and I see that Renata wrote I thought it was still legal. Not here. It is still legal in many other states. So I mentioned voluntary stopping eating and drinking earlier, and I didn't really explain that that's an alternative to medical aid in dying. Medical aid in dying is obviously much quicker, and you have more control. You take the medication. Sometimes people, and usually people, if you're unfamiliar with the process, once they take the medication, they usually slip into unconsciousness within like 10 minutes, 20 minutes tops, usually, and then everybody, it's depending on how frail somebody is, how sick they are. Sometimes they die very quickly, sometimes it takes several hours to die. But at least you have control over the time and knowing exactly when you ingest the medication. Voluntary stopping eating and drinking is what it sounds like. People decide they want to die. Medical aid in dying might not be available to them, whether it's because it's illegal in their state or they have an illness that's not covered. Because only certain illnesses are in here in Hawaii, it's like, okay, cancer, of course, is one of them. But like, for example, the folks at ASP, a Sacred Passing in Washington, had a voluntary stopping eating and drinking death with someone who had Huntington's. And even though they were in horrible pain and requested made, they were denied. And so they made the choice to do voluntary stopping eating and drinking to end their suffering, right? So in some places where MAID isn't legal still, that is a choice that a lot of people make. And sometimes, like I just said, sometimes even when it's legal, other people have to make that choice if they're denied or don't qualify for it under the current law.
there is a question about what advice you would give, but let me give you a quick case before that, because I
Sure.
see we got time. Okay. I've got an 89-year-old male who is unable to walk, having difficulty swallowing, just lives in a assisted care home with his wife. Um, he is not comfortable. He's always in pain, but his wife doesn't want to get any assistance with dying because she's in denial and doesn't want to think of him as dying.
Mm-hmm.
He's getting evaluated for swallowing difficulty. He's had cancer and has um, a diversion of his colon into a
Mm-hmm.
bag. So she knows he's not eating or drinking much because nothing comes out for her to change. She has daily assistance from the VA during the weekdays. So she thinks everything is fine. He will not say he wants any intervention. But she's very clear. She doesn't want a death doula. She doesn't want anything because she don't want him on hospice, nothing because he's not dying.
Mm-hmm.
What do you do in that situation where the individual can't even really state their wishes because a spouse is so adamantly against it?
Yeah. Well, me personally, that goes to show the importance of how do we talk about death and do this type of education upstream. Because what's going on there, that there's such a denial. There's such a denial of death and fear of death. And the reality is, if you try to insert yourself too too harshly into that and try and make them see reality, you're probably going to get pushed away at that point, right? So there's a choices being made there. That person's probably not going to have a great death, right? But it had we talk freely about death in general around each other. We had actual health education in school that included disease and death and grief instead of like my gym teacher in sixth grade telling me not to smoke behind the high school. You know, like
Mm.
what if we had real health education and that included, we will get sick, we will have accidents, other things will happen, and we will die. What does that look like, right? So it's I'd say in terms of that, it's really important to have honest conversations about death and dying, speak about it freely, and in hopes that we encourage others to also speak freely. So that's one thing I always say about myself. I am not popular at gatherings because I talk about death, I talk about drugs, and people are like, "What? Who invited that person?" But it's because I want to normalize all these conversations. I want to normalize it all, and if that makes me the person standing alone for a little while with my drink, that's okay too. But I think we need to just culturally shift that, and then we won't get to these very isolated, like those people are very isolated and alone, and if they're stuck in their ways and they're not going to hear you, that is the death that they're choosing.
Yeah. I like to tell people that um, it, even if they get on hospice, it
Mm-hmm.
doesn't mean they're going to die.
Yeah,
It's just a way to
absolutely.
help them be more comfortable. And people go off hospice all the time. But when you're really in need, hospice provides a lot of services. A hospital bed at home and oxygen and
Mm-hmm.
morphine, I mean, just
Yeah,
tons of services. And so it's not a death sentence
yeah.
per se with hospice, but even that doesn't go over too well with these.
Yeah, some people get better on hospice.
Yeah. Yeah.
Yeah, someone just wrote that they could extend life too. And
Yeah.
I think it's because we don't talk openly. Like going back to my story, like I hadn't heard of hospice, which is wild. I know perhaps I grew up in a small town though, and nobody mentioned it. And I look back to when my grandmother was dying, I didn't know anyone who had been seriously ill. I had known people who had died at that point, but they had died of suicide, drug overdose, and or accidents. I had never seen the trajectory of disease in anyone. And so, just the fact that I didn't even know hospice existed, it was a huge barrier, right? Luckily, times have changed. Like hospice and palliative care is,
They,
is all
yeah.
over the news. But there was a time where that wasn't the case, and people heard the term hospice if they had heard of it and just like froze, like, oh, so I'm gonna die right now,
Yep.
right? So those stereotypes, if we talk more freely about this stuff, hopefully they go away. And shame dies, right, when we talk about this stuff. So hopefully there's no shame to people for choosing it. Um, yeah. I see, real quick, I see someone wrote, what advice would you give as a first step to someone who's interested in exploring doing death work? Well, first of all, you don't have to pay to take a course. So I say this as someone who like teaches a community death care course. I always tell people if you want to take it, rad. If you don't, that's cool too. There's tons of free stuff out there. Like that's the thing is that YouTube, they're like I used to be on the board of the National Home Funeral Alliance. I did a term on their board, and we did a series of educational videos that are free on YouTube about different aspects of community death care. We also published online a home funeral and community death care guidebook that it's donation based. Like if you can pay $20, cool. If you can't pay anything, hit zero and download it for free. And it's super detailed about body care and home funerals, right? So even with a sacred passing, we have a Vimeo site. Vimeo is like a video sharing, not unlike YouTube. Um, and we have a series of we have a monthly webinar series that gets posted every month, and we do tons of free webinars that the education is out there. So, and that's just us to name a few orgs. There's tons of orgs out there putting out free content, and it also depends on what you're interested in. There's plenty of free modules and stuff in there about like advanced healthcare directives, about how to have these death conversations. And also grief work. Yeah, I'm a therapist, and also grief work is done in community. There's lots of peer grief workers out there that do support groups and do peer grief support. Like, you don't need to have letters after your name, and you don't have to pay for education to do this. You can just go out there and think about where you want to be more helpful in community, where your strengths lie, and go for it. Oh, you're muted.
Good point. We had a comment that Hawaii Hospice changed their name to Navion because of the word hospice. Uh,
Yeah, but Navian's even more confusing. I mean, no shade to anybody if on here who works there, but I feel like that was way more confusing. Like when Navian's like, "What's that? What's that?" Like I remember when they changed their name, and it was a lot of like, "That sounds like a medication." Like, so I think I hear that that that's why they changed their name, and also I think it's more confusing now that they changed their name to that.
oh, Marie said all hospice agencies remove the word hospice because they offer other services other than
Yeah,
hospice now.
yeah.
Same with Hilo Hawaii Care Choices.
Yeah.
Yeah,
Hawaii
that's
Care Choices, though, at least tells you a little bit what they do,
mm-hmm.
to be
True.
honest. So that's a little
Mhm.
more. And then, oh, I see that there's an educational thing coming
Mhm.
up for also, I don't know if God, there's so much stuff I could be put in the chat, but I can't really talk and do it at the same time. We I think it's also up on the Vimeo that you put in there for a sacred passing. We hosted Joy Rodriguez, the doula I mentioned earlier, hosted a panel, I think 2 years ago now, perhaps, of people who have attended our support group with to talk about their person who chose MAID, to like talk about their experience, and that's available for free too. So if you want to hear directly from someone who like walked beside their person who made that decision and what that death was like for them, that's free online as well.
And here's a question. What are best talking points for family members who do not agree with a loved one moving on?
I think it depends who's the person doing the talking, right? So they're going to hear it really differently from me than from a family member or a friend, right? And some, I think it all depends on style, community status. Like Kapuna might have a very different conversation like with a loved one or family member than me, who they're just like, who are you coming into my house, like trying to tell me what to do with my family, right? So I think it really depends on who you are, how to approach it. Like if somebody is bringing me in specifically to talk about that, then I'm going to just be as direct as possible, right? Of like, this is what we're dealing with here, and if and when you're ready to to be honest about the situation, honest with yourself, honest with your loved ones, let's work on this. But I can't force it, right? None of us can force it. Like people, like even going back with my grandma, she was like actively dying, and they sent her home from the ER. you know like, we just don't know. If we don't know what that looks like, it's hard, it's easy to be in denial, right? So like, um the reality is that you can do everything you can, and sometimes people will still be afraid to talk about death or in denial about death, and that is what happens for them. That is how the end comes. But we can do what we can to offer resources, to be there to talk to be kind, to be approachable. And yeah, and it ends up how it ends up.
Renata has a good question, but I don't really understand it. Do you wanna say it, Renata? I mean, you can read it.
Hey, can you hear me?
Yes, thanks.
I don't know. This is something that for people like me who are primarily focused on like health prevention and promotion and disease prevention and like works with children and all that stuff, like how I just I don't know how to ask it differently than what I wrote. Like, how do you recognize the point? Maybe like a physician can say it or a geriatrician, but how do you recognize the point where like we cannot do any more to save you versus, like we can squeeze out a little bit more of life from you and make it like quality. I I mean, I don't know. That's like one of the hardest things for me to like conceptualize in my own brain.
I'm not sure I can answer that question because I'm not a physician. I mean, some of this is I think in terms of diagnoses, the unfortunate, but actually, I let me backstep that a little bit. Sorry, I mentioned the National Home Funeral Alliance. I'm putting their website in the chat if you want to get the free resources from them. Actually, and there's probably doctors on this call that might be like, hey, wait a second, but that's okay. Some doctors are historically bad at diagnosing how long people have left to live. And that's not their fault. Sometimes it's the body is confusing and everybody's disease trajectory looks really different because like if someone was already frail, already had other things going on, they get cancer, that's going to look really different than somebody who was like really healthy and doing well and their body isn't as frail, have other things happening. I mean, everybody's body and how we react to disease, everything is very different, right? So it's not necessarily their fault that it's hard to tell the trajectory of someone's illness, like how long people have left to live. Because I have seen, when I mentioned I was a hospice volunteer, they assigned me a new hospice patient and they're like, they just were enrolled in hospice today, blah, blah, and you'll meet them tomorrow. And I was like, cool. And then the next morning I wake up and I got a voicemail, the person died last night, naturally, right? And so it's like, why were they enrolled in hospice less than 24 hours before they died naturally, right? So obviously there was some disconnect there. And so I think it's not that we always know, when people are like actively dying or how close they are to death, but like how do we just work through that as we go, of like how do we prepare, how do we have honest conversations, how do we have things in place. But yeah, it's hard, it is hard to know.
And as a physician, they teach us not to give somebody a set time because guess what? They will die then, unless they really have a objective to make it to. But they also teach us to discuss advanced directives as early as possible when someone is healthy and able to make their own choices and very clearly describe those choices. Because if we wait too long and they don't have the ability to make those choices clear to their family, then it's not going to be their choice. It's going to be the family's choice. And
Yeah.
that's usually prolonging things that maybe an individual doesn't want.
Mm.
So, which
Yeah.
a family can do anyway.
Yeah. And I would just say, because I know we're about out of time, two things. There's a question I'm going to answer, and then advanced healthcare directives, I'm obsessed with them. I have one. I've had one from ever since I found out what they were, right? Like, I think that everyone should have one. If you do not have one and you're on this call, please figure out how to get one ASAP. It doesn't have to be that big. It doesn't have to be a lot of thought unless it is, then that's because you haven't thought about any of this stuff before. That's okay. But truly, please have an advanced healthcare directive in place. Like, I don't care how young you are, if you're over 18, you do, and you are an adult, have one in place. Everyone needs to have one because you have no idea what's going to happen tomorrow or today, going home. And you want to make sure that the person who you want to make your decisions for you, if you cannot speak for yourself, is able to, and it's the right person. Because the right person is not necessarily your spouse if you're married, and if you're an unmarried adult over 18, they're going to be like, can I get a hold of their parents? Are you estranged from your parents? Do you like your parents? Would they make the right decision? I mean, it's all really important stuff to keep in mind, making sure your wishes are carried out. So please fill out an advanced healthcare directive if you don't have one. And then really quick, are we able to reach out to me to coordinate counseling if somebody's trying to access our care choices, access medical aid and dying? My preference is writing me directly and not copying the family on it, because that has happened to me a couple times where they've been like, oh, this is Leilani, they're going to do your mental health development. I'm like, what? I was like, I am on the continent visiting family. I am not around today. So if you, I'm happy to do it. Like I said, I volunteer doing it, do it pro bono, did one yesterday. But please, if you have a request, just email me directly and ask if I'm available first, and then I'll ask the details and how, if it's dire, if it has to be done that day, I may not be able to because I have a full patient load for therapy. Sometimes, 5 people back to back, I might not be able to. So, but I will do it if I can, and it doesn't have to be that day. So.